So it's a pleasure to have you all here today. This is an incredibly important topic area, an area that where we can have considerable impact. And our REACH Center and our approach of implementation program science is really a way of thinking about how do we make things work in the real world. So it's just a great opportunity for us to think through how we do this and how we make it work for our local and regional communities. So.
And then we have the training and linkage to care. This is a large piece of the program. We really want to ensure that the pharmacists felt supported in conducting HIV testing. This is something new to them. They really took it on quite well. They were excited to have an increased scope of practice, but we really ensured to have this streamlined and so that they were confident and competent in performing the testing.
And so the goal was a lofty one. It was to administer 5,000 point-of-care tests over a 6-month period. It actually ended up being a 4-month period in Vancouver's downtown east side. And most people we've sort of laughed. Let's see if they can do this. So this slide tells you dramatically the success of the project. These are our point-of-care testing results leading up to the implementation in June 2011. And then, boom, we did a lot of tests over that 4-month period.
There's also high satisfaction with service providers. It took them a while initially to get used to it. They found it a little messy. How are they going to do this? But in terms of their experience about giving people a result immediately, seeing the result immediately, they said it's shitty to tell somebody that they're positive, regardless of whether you have 10 minutes or 3 days to prepare.
So this was the recognition that we really had a market on that. It was heterosexual intoxicated sex was the #1 leading cause in Manitoba. Well, we were seeing 12 to 13,000 people come through our intoxicated detention facility with that age range that we were looking at for this demographic. So we said, let's set up a pilot program where the paramedics offer point-of-care testing.
One of the most important pieces of a test like this is the instructions for use, because that's the bridge between getting a proper test, between the test and the user. So what was recommended was that the test perform at a sensitivity and specificity of 95% as the lower bound of the 95% confidence interval. The specificity turned out to be fantastic. But the sensitivity, instead of 95%, turned out to be 87% in the course of this clinical trial. FDA had 2 choices, one of which was to say, go away and come back with a test that works better. The other was to see, so what does 87% give us? And this is something that I want to emphasize here, and that is to conduct some sort of a risk assessment to know what a given level of performance is going to give you and not dig your feet into the ground. So FDA put together a risk model which showed that for every, you would be getting 6 people who would find out that they were infected who didn't know it before for every false negative, okay, a 6-to-1 ratio, and 4,000 new infections would be averted as a result of those people knowing that they knew their HIV status, and this would be in the first year of use.
And for me, it's all about early diagnosis. The value of early diagnosis, not to repeat what's just been said, in terms of saving lives, in terms of making treatment more effective, in terms of stopping spread, has led many, many workers to realize it's no longer an option to wait for somebody to become ill and visit your hospital. You really need to go out into the community and actually find people who are not testing. You can have the most sophisticated, regulated laboratory in the world, and I guess you do here, but that laboratory can't diagnose anything if that sample doesn't come through the door. And as I visit these workers, the one thing that comes through to me is the sense of satisfaction from people who are self-testing for HIV, the feeling of confidence, of confidentiality that they have, convenience, the empowerment that they feel. That word keeps coming up again and again, particularly in the high-risk community. They're empowered to know their status and maintain their status.
We were quite happy that untrained users can get these tests to work correctly. And this speaks well to being able to implement a test like this in the hands of community testers, peer testers, people who are not necessarily trained healthcare providers or professionals, but peer testing, and this is a good data set with real clinical data that these tests can work in the hands of these types of individuals.
In those forums, I'd say that I was one of the barriers for sure, because we had so many questions, like what, you know, things that now we look back on it, but what about counseling? What about consent? What about QA, QC? What about potential for abuses? All the things that have been mentioned. We did no advertising or promotion, of course, but it takes like 5 minutes for word to spread, and we were pretty swamped pretty quickly when people heard there was the availability of rapid testing. And I remember one of the research questions we had lots of laughs about after, because we were trying to look at people's decision making around testing, and why did you choose the rapid test? And I don't know how many people wrote, well, because it's rapid. It's like, okay, right, that makes sense.
So what are the concerns with self-tests? Is we've always, I think I alluded to these things before, and we say, okay, self-tests are good, nice, but what about accuracy? So we know that, yes, the accuracy is not 100%, but it's 98.5 to, the confidence interval is ranging all the way from 98 to 99% when you use it in supervised settings, and when you are going to give it to, lay people, the accuracy is going to be a little less. But if you inform them that there is this issue, then people are more informed, more aware. Those who are at risk will, repeat the test. So there are ways of working around it, but not making it a moot problem so that tests don't get approved. There is a way of looking at evidence. So the HIV Smart Web has a tutorial that walks you through the process of testing. It also educates you on the probability of getting a false negative or false positive. The false positive is less than false negative. For me, false negative is a bigger concern. So walk them through that. And we also have an app. We haven't released the app on Google Play Store, but we have extensive plans to release it in the next two months. We have an Android app. We're also working on an iPhone app. We're also working on several other applications in the pipeline and testing them out in different parts of the world. And this app can pretty much guide you. It distills what you need to know as far as self-testing is concerned.
What is serious gaming? So we know that serious gaming is a game designed for something other than pure entertainment. But certainly it's a game used to educate or train learners. And we know that serious game has already been employed in many fields with adults, such as compliance issue, customer service, employee safety, and sales. So why not in the field of health?